Clementine is missing. Clementine is an experiment.
That's probably one of the worst mindsets I've ever been in.
How do you get a 5-month-old fetus out of a pregnant woman in less than 3 minutes in the operating room?
I was afraid I was going to die, but now I know the truth.
They didn't tell you we're going to be harvesting your baby afterwards.
No, that was never brought up. They just told me to ignore that bottom part.
This is the same organization that was doing government-level harvesting of FDA product-grade fetal organs.
This was a human trafficking. How many pieces is she in?
The most important part really is saving her. In saving her, making sure that this never happens again.
A baby trafficked for experimentation, apparently after being born alive in a late-term abortion. A mother violated and traumatized, now fighting to find her child. I'm David Daleiden with the Center for Medical Progress, and today I'm joined by our associate reporter, Elise Ketch.
Medical records shared with CMP revealed chilling evidence that a little girl was delivered alive prematurely at 5 months and 1 day gestation at the Cherry Hill Women's Center in New Jersey, and then trafficked for organ harvesting through Cercle Allocation Services. This little girl's name is Clementine, and this is her and her family's story.
CMP interviewed Clementine's parents in early 2025. Clementine's mother has asked to remain anonymous due to the trauma of what she experienced and while official investigations are ongoing.
So we've anonymized her face and voice throughout this presentation. At some points during the interview, she preferred to read from her journaled reflections because discussing what happened was still so raw.
As you listen to their story, please remember that this is just one example of what can happen to tens of thousands of young people in crisis at taxpayer-funded abortion clinics across the country.
Our story begins with a young couple in their 20s falling in love. It's the late summer of 2023 when Clementine's mother meets Tommy Kearns, the father of her future child.
My world stopped when I met Clementine's mom.
Simple conversation turned into big adventures, and it was exciting.
So when we had first met, it was an instant connection.
He asked me to hang out. I was like, well, what do you want to do? He was like, do you want to go into the city? And I was like, heck yeah, I want to go into the city. That was the first time we actually ever hung out. It was just random, but that's like, I don't know, part of it, I guess. We just get along so well. We like the same things. You like antiquing, I like antiquing. You like food and coffee, me too. I like to travel, let's go. I got a car.
And it was just really, really fast. It was really easy to trust one another really quickly.
We were just immediately comfortable with each other.
After about 3 months of traveling together and enjoying each other's company, on November 17th, Tommy and Clementine's mother made an unexpected discovery.
We had just finished our road trip.
Yeah, I was late. And what do you do when you have a late period? You take a pregnancy test. So I took one and came back a little fuzzy, and then I took 4 more and they all said pregnant.
I was like, what? The big, okay, yeah, this is real for me was seeing the pregnancy test.
Clementine's mom, how did you react to the news?
It was just a real wave of just shock and nerves, and immediately just going like, okay, now what? I wasn't prepared. I've struggled with a lot of things my whole life, and where I was and in my life at that point in time was just definitely not what I was expecting I would be at being a parent.
There's so many things like that were rushing through my mind. It wasn't like, okay, how do I get out of this? Or where's the exit? Like, it was just like, okay, what's the next step? What do I do now? Here's the solutions.
I felt confident knowing that the father was very much supportive and involved and loves me and loved Clementine.
At this point in their relationship, Clementine's parents were long distance, with Tommy living in Florida while finishing probation for a non-violent marijuana case, and Clementine's mother living in Delaware, but they were excited for another adventure together and wanted to make it work. Who named Clementine?
Clementine's mom
brought up that name, and it kind of just stuck. We both really just liked it. We liked the way it fit.
I said, well, what are we going to nickname her? And her mom said, we could call her our little lemon. And that's when I was like, okay, that's actually really cute. Her name stuck.
Did you love Clementine?
I do love Clementine. When I was pregnant, my one boy cat, he would just sit in my lap, like with his head kind of on my stomach. And he would just sit and purr, and it was really nice because you knew that he knew.
She had just flown in. We're in the room. She's like, Tom, like I feel weird. It's like a flutter. We Googled what like a flutter feeling was, and that was Clementine moving around. When she was back around me again and she would hear my voice, she would be doing cartwheels. She had told me that it shows how much Clementine missed me, like hearing my voice. As a family, we have a lot of memories together. Clementine was a part of every single one of the adventures.
Yeah, exactly. Lots of laughs.
And Clementine was there for every joke and every picture and every memory.
Burger.
Every burger, every coffee. I really hope that she was having as much fun as we were having.
Take me to the day that you met Clementine.
We went to the pregnancy center. They're doing the sonogram, and I immediately walked in and I saw our baby. She was about, I think, 9 or 10 weeks. The heart murmur was up on the screen and I could see it. They asked if we wanted to hear it. We said yeah. Then they asked if I wanted to hold her. And it was a tiny little diagram. She would have been about the size of a strawberry. So I was holding her. I'm looking up at the screen and I can see her. And I'm listening to her heartbeat. That was the first time that we met our daughter.
That was definitely the moment that made everything real for me. In that moment, that's when I realized I really was a mother. And everything was seriously real. And it's not just a clump of cells like everybody likes to say. And it's like, this is real. There are her arms, there are her legs, and pull out a diagram of how big she is, and you can hear her heartbeat, and it's very real. And that made me really scared because it made me realize how unprepared I was and that she's gonna come here soon. And that put a lot of pressure on me personally.
To better understand what Clementine's mother was experiencing, we spoke with Lisa Marie Oxenham, a licensed professional midwife and pregnancy expert.
When women are pregnant, it's like your superpower. They become very perceiving, their intuition is heightened. It's an incredible time for them to really trust themselves. And then the shadow side of that, of course, that superpower can also turn in on herself because it's almost too much for her to contain and she'll question it. She won't believe herself. No way can that be right. No way does she have what it takes to carry this baby forth, depending on where she's at mentally to begin with, and what kind of living situation she's in, what kinds of voices are in her head. It impacts everything when you're pregnant.
Pregnancy can be challenging under the best of circumstances. But in an unexpected situation like for Clementine's mother, the pressures didn't just build, they felt like they multiplied in every direction, causing everything she wrestled with to rise to the surface.
Not having a career, not having money, living at my mom's house, doing long distance, having a crappy car that doesn't even have brakes, recently just getting in a fight with my father and not on speaking terms with him. It's just anything and everything. I just really wanted to make sure everything would have been perfect.
And hearing that, it crushed me. I didn't know what to do. I didn't know what to say. She wanted to know that she was strong enough, that if she had to do things by herself, she could. She tried really hard to fight overthinking. She tried to fight her self-doubt. But when you love somebody so much and you care about them so much and you want the best for that person, it's really hard not to overthink.
It was hard when I was alone, you know, and even when I wasn't alone, sometimes I would make myself feel alone. I was violently sick most of the time, so it made it a little bit tricky to enjoy the nicer things. And when I wasn't the one who was stressing myself out and my mental health was getting in the way, then my body started getting in the way.
Gosh, that's gonna make her feel incredibly alone if she doesn't have any other support and it's just all in her head. I could see that a person like that would make more radical decisions that aren't even in line with her own value system. We see that actually play out a bit. Midway through and you feel like you have no ability to do anything right. You're so vulnerable to making a wrong decision or a decision that's more harmful. That's a really scary place to be.
I just wanted things to go back to the way they were, and I didn't know how to fix it. I didn't know what the problem was. I just wanted a new life. I couldn't see it. I couldn't see everything else. I couldn't see her. I just saw fear and failure. I hate myself so much for that.
If you have a woman dealing with deep shame, and it doesn't matter her age, it doesn't matter her relational setup, if she's got a lot of internal shame and then she's pregnant, and then you've got that extra acuity and clarity about things, and you realize, I can't be a mom. Who am I fooling thinking that I have what it takes to parent a baby? And in those moments, in that shadow moment, if she's not strongly supported with the community, saying, no, you don't have to have what it takes right now. You do have what it takes, you don't have to feel like it. And let me show you how strong you actually are. Luckily, we get to be that community for many of our moms.
Clementine's mother wanted to talk to a doctor about what was happening to her. Feeling alone in her long-distance relationship, isolated from others, and disconnected from herself, her worries spiraled. So on March 10th, 2024, in desperation, she called the Cherry Hill Women's Center, expecting the kind of help and direction she had received months prior at Pregnancy Solutions, the Pregnancy Resource Center in Florida. Would you say you were in a healthy mindset when you made your initial call to the Cherry Hill Women's Clinic?
That's probably been one of the worst mindsets I've ever been in, hence the reason why I made the call. I don't know what I was looking for, not that. Literally had no idea what an abortion was. Nobody ever explained anything to me either. I didn't know what procedures entailed. I didn't even know if it was legal. Like, I was literally just calling to ask questions.
What she didn't know is that the Cherry Hill Women's Center is one of the top 10 third trimester abortion centers in the country and has been a fetal organ harvesting site for decades.
I wasn't calling to schedule an appointment. I didn't have money to schedule an appointment. I was literally just calling to ask questions, and then they just were pushing. Like, this is, normal. You gotta go and do it. It was pushy. They were very persistent.
Cherry Hill routes all of their calls to a central call center for the women's centers. Is this like the front desk?
It's a call center.
Oh, okay.
So rather than a counselor, Clementine's mother spoke with a salesman, who quickly insisted she schedule an appointment to come to the clinic in person.
They promised I would be taken care of, so I believed them.
On the undercover call, the center agent disclosed Cherry Hill's main funding sources.
We do our financial assistance through the National Abortion Federation. The financial assistance I would do would knock those prices down to half. Cherry Hill's got a good amount of different funding to help patients.
What they didn't disclose was how they would offset the cost by harvesting Clementine's valuable body parts for experiments.
On March 12th, Clementine's mother drove to the Cherry Hill Women's Center. Still in a state of crisis upon arrival at the facility, she stayed in her car and attempted to regulate herself by smoking legal marijuana.
I smoked a lot because I knew I couldn't when I was in there. I was stressed out and it made it worse.
After a short stint in the waiting room, a nurse guided Clementine's mother to an office room. The nurse then read her questions from a computer, including about substance use. Clementine's mother disclosed to her that she had smoked before entering the building.
In that situation, that's normally where someone would tell you, oh, you can't be under the influence of marijuana, we're gonna have to reschedule this for another day. And then she's telling me that's perfectly fine, and she smoked during her pregnancy, and she had an abortion, and this is normal. It just made me feel uneasy.
To get a medical perspective on what Clementine's mother experienced at Cherry Hill, we went over her medical records with two obstetrician gynecologists who used to perform abortions, Dr. Catherine Wheeler and Dr. Kathy Altman.
The patient has to be able to make a valid decision for themselves. In my understanding of how marijuana impacts the brain, they are completely incapable of making those decisions. She's got a heartbeat of almost 100. Like, what was that about? Like, did she smoke on the way in? Is she that anxious? You would have to say, tell me why you're so distraught. Like, is this really a free decision for you? Tell me what this is really about. Something isn't right about the situation.
After documenting that Clementine's mother was under the influence of mind-altering substances, Cherry Hill began to prepare her for a late-term, multi-day abortion, not disclosing that they were preparing her body and her baby for fetal organ harvesting. Once they finished intake, a nurse brought Clementine's mother to an exam room. She got on the table and a technician gave her an ultrasound.
They're estimating that this baby is 20 weeks based on that. The fetal cardiac activity, that's the heartbeat, and so there was a heartbeat, so this baby was alive.
Fetal cardiac activity, they're saying that they actually see heart motion, so baby's alive.
I was scared. I asked if it was going to hurt. One lady looked at me funny. I asked, is it normal to cry? The one lady said, it's okay, a lot of people cry. I was shaking, I got even more scared.
The nurses then proceeded to insert Dilapan dilators into her cervix and then left them to expand for nearly 24 hours.
With the first one, I immediately broke out into tears and started flinching. It hurt so bad. I was screaming, saying it hurts over and over again. It's one of the most painful things I've ever felt. And the nurse said that she thought I was going to pass out because I turned white and I was sweating. I got up and I felt like I could barely move. I changed into my clothes and I felt wrong. I just felt like I was doing something I wasn't supposed to be doing.
The cervical dilation is the most painful part of the procedure. The Dilapan, they inserted 5 of them. Anytime we were going to be dilating the cervix, we would do a paracervical block. A paracervical block is actually a series of injections to numb the pain fibers in the cervix. It's just too painful otherwise.
The worst part is when you first put it in. It's almost like a shock to the cervix. So they really should have been putting in a block with that. To me, that would be intolerable to not put in a block if I'm going to put 5 in.
I just think it's barbaric that you would dilate a nulliparous patient who had not had a child before, to 1.5 centimeters without any kind of anesthesia. Is crazy. It's barbaric, really.
What Clementine's mother was forced to undergo that first day was not typical protocol for a later abortion procedure.
So it's interesting that they have all these extra consents. There's one for causing fetal demise. I think it's interesting that they say injection to stop pregnancy growth instead of just saying injection to kill the fetus. And that particular consent is not signed, so that they had no intention of killing the baby prior to the procedure.
They didn't tell you that you didn't have to sign this bottom part because we're going to be harvesting your baby afterwards.
No, that was never brought up day 1 or day 2. It was just completely ignored. They just told me to ignore that bottom part.
Late-term abortion providers sometimes use an injection of what they call feticide, chemicals like digoxin or potassium chloride, to cause a lethal heart attack in the pregnant mother's unborn baby, killing the baby the day before removal in the operating room. Laboratories that experiment with aborted baby body parts know that this induced fetal demise severely compromises the usefulness of the fetal organs, cells, and tissues for experiments. A recent study by a government-funded fetal harvesting lab compared the organs harvested from freshly aborted babies versus organs from babies killed by feticide the day before. They concluded that warm ischemia, or lack of blood flow in the baby's body following circulatory arrest, is the principal driver of tissue degradation. They wrote, induced fetal demise followed by delayed evacuation is associated with greater cellular damage and apoptosis, reduced cell proliferation, and poor nucleic acid quality, and that prolonged incubation at body temperature without fetal circulation is the primary driver of the poorer tissue quality observed in terminated fetuses. So when a baby in the womb is scheduled for organ harvesting after elective abortion, for the organs to be usable, the baby has to be kept alive as long as possible before harvesting. No feticide beforehand.
The digoxin is normally administered when they come in to do their cervical dilation, so the day before. Normally you would give some sort of a chemical. You'd give either digoxin or potassium chloride or lidocaine. You'd inject one of those medications, and nothing was given to kill the baby.
So it says fetal demise induced by, and then it says not administered. So they did not do anything to be sure that the baby was dead.
Some doctors make sure the baby is dead before they start doing the induction abortion, because I think there was one study that was showing that 50% of babies survived if they weren't killed first.
On March 13th, after a day of pain, unsure if Clementine was alive and believing she had to complete the abortion, Clementine's mother returned to Cherry Hill as directed.
The next day, to try and help with the pain and my emotions, I just vaped the weed concentrate in the car ride. I was extremely anxious and nervous, and I didn't know what to do.
Once inside Cherry Hill, Clementine's mother was escorted from the waiting room to a bed in the patient ward. She could hear the other women and girls suffering behind the curtains next to her, and she grew more frightened.
The nurse would come by every so often to ask me my pain level, which was just progressively getting worse each time. I was in so much pain at one point I thought I was going to pass out. I was already here the first day and I had an IV and I didn't think I could just leave. I was then given 2 pills. I don't remember the name because I could barely even stand up.
So this is at 9:48 a.m. and it appears that she was given misoprostol, 200 micrograms, 3 of them, so 600 micrograms by mouth. So it's a common dose now used in second trimester abortions. To induce labor, much, much smaller doses are done, like 25 micrograms, sometimes 50.
Misoprostol is a drug that causes the uterus to contract, so it's used in abortions. Then it's also used for labor induction where you want a live birth. It can be used there to cause contractions of the uterus.
So misoprostol can cause very powerful uterine contractions.
Absolutely. They're called tetanic contractions because they're so strong and so long.
I felt sick, I was nauseous, I had severe cramping, my head was killing me, I was sweating. It was such a short amount of time. I was in so much pain. I was trying to position my body in spots where I couldn't feel the pain.
So an hour prior to that must have been when she presented, and she was having abdominal cramping rated 4 out of 10. That was her pain rating. An hour after getting the dose that she got, she reports that her pain level is 8 out of 10, and they call it abdominal cramping.
So I think it's interesting that they consented her to misoprostol on day 1 so that they knew that they intended to use this drug that would cause contractions. They don't mention the fact that this is also used for labor inductions or that it could possibly throw her into labor.
If your intention is to induce labor, they need to know, I'm intending for you to go into labor. Absolutely, if that's the intention. So if their experience was people essentially go into labor and have labor type pain, yeah, I think she should know that, especially if you're not going to offer any pain relief.
It's sad that they didn't let her know that that was a possibility, because when you're giving a drug like that, there's also the possibility that the baby could just be spontaneously delivered. And now with fetal organ harvesting, it's ideal to have the baby more intact or completely intact.
I've never felt cramps like this my entire life. They were a 20 out of 10.
Can you imagine a 600 microgram dose of misoprostol
Oh my gosh,
given
no.
to a woman who's 20 weeks pregnant?
Oh my gosh, no. No, that's really high. That's gonna cause the uterus to contract really, really hard and be very painful. And doing this without pain medication, I would presume. That's really sad, actually. That's trying to evacuate the uterus, because that's what that would do. Yeah, they should not be doing that. That should be illegal, actually, using it that way.
What do you think it's like for the baby?
It'll be throwing the walls against the baby really hard. That would be scary. So they're being violently squeezed on and having to somehow deal with that for however long this process takes. It's unconscionable to me to do that to a viable baby. But I imagine that the situation that this is called for, people aren't thinking about what the baby is experiencing.
Around 11:20 a.m., Clementine's mother told the workers that her pain had reached a level 10. They then told her that they were ready for her and wheeled her into the operating room. Just outside the door, they were stopped. A nurse handed her yet another piece of paper, the consent form from Cercle Allocation Services for fetal organ harvesting.
Cercle Allocation Services is the rebranded version of the company Advanced Bioscience Resources, which has been harvesting and selling aborted baby body parts across the country since 1989. This is the same organization that was doing government-level collections of FDA product-grade fetal organs, according to the Planned Parenthood leaders who work with them.
We have already a relationship with ABR.
With my business head that
using them for over 10 years, a really long time. So I just kind of renegotiated the contract. They're doing I can't remember what they call it, but the big collection for government level collections and things like that.
ABR Cercle sold fetal body parts to taxpayer-funded labs for up to $7,000 each, when harvested according to FDA-regulated current good tissue practice, which specifies the fetal organs must be recovered in a sterile manner, most feasible when dissecting out of an intact fetal body.
CMP's undercover reporting on Cercle, back when they were called ABR, captured horrific admissions about babies being delivered alive for organ harvesting. Admissions that tragically seem to foreshadow what happened to Clementine and her mother at the Cherry Hill Women's Center.
And I literally have had women come in and they'll go in the OR and they're back out in 3 minutes. And I'm going, what's going on? Oh yeah, the fetus was already in the vaginal canal whenever we put her on syrup. It just fell out.
You mentioned the fetus falling out situation. How frequently would that occur in your estimation?
I don't know, once every couple months.
How does a tissue procurement occur in one of these situations when the entire fetus is intact in the lab?
We do dissection. I can see hearts that are not in an intact POC, that are beating independently.
So here we have the permission form from Cercle for the fetal research donation. Did they explain to you at all what this was?
No. While I was going into labor, they handed me this form and she just asked me to sign it. And that's all she said. She said, you should sign this paper before you go in.
In that moment, Clementine's mother was fearing for her life. It was her most vulnerable moment, and it was the perfect trap.
I was afraid I was going to die. I didn't know what was going to happen if I didn't sign it for the surgery. I felt like I had no choice. I was trusting them, so I signed it. Experiencing labor pains, not knowing that you're experiencing labor pains. No, I did not read that. I just signed it because what else was I supposed to do in that instance?
This is the only permission form that doesn't have a date, and I suspect this is what they handed her when she was in extreme pain and couldn't make a decision, and there's no way you could have told her all this stuff.
It says on here, I've been given an opportunity to ask questions. You have an opportunity to ask questions when your pain level is at an 8 or 9 or 10 out of 10.
I doubt it, and she said she wasn't, she wasn't.
In labor pains from the Misoprostol, Clementine's mother never even had an opportunity to meet the abortion doctors who would be taking possession of Clementine that day. Dr. Alina Hoover, a trainee in Planned Parenthood's Complex Family Planning Fellowship, and Dr. Richard Liebleck, who was accused of killing a patient through negligence in a 2019 lawsuit that Cherry Hill paid nearly $1 million to settle.
Reading on the medical documents, there's a part that says that all of the staff involved came up and personally introduced. That was not the case for a single one of them.
So they lied on your documents?
Yes.
Horrific.
Multiple times. That was just one of the instances.
After she was taken into the operating room, all she was told was to get up from the chair and onto the surgical bed.
I was shaking. I kept saying, I'm scared, I'm scared. They were aggressive and I knew that something was wrong. They helped move me up. I never had such a hard time getting up my whole life. I could barely move. They told me to relax. I could not. I was very tense. I felt raw and numb and exposed and vulnerable. I started to cry. I said I was in so much pain. I said I was freezing. They were trying to get me to relax because I'm basically having an anxiety attack. Within seconds, I had a mask over my face and then I passed out.
So to recap, they forced Clementine's mother onto the table, held her down, and knocked her out with powerful anesthetics. And that was only the beginning of the horrors that were to unfold in that operating room.
We presented all of the medical records from the operating room to Dr. Wheeler and Dr. Altman in order to ascertain the timeline of what happened during the procedure.
The time that they came into the room was 11:21. Confirm the patient's identity and everything. That's a nursing thing. Anesthesia safety check, pulse oximeter. These are all things to make sure that everybody's ready to go. They have some pre-procedural vital signs, and it's interesting there that her pulse is all the way up to 117. So it's hard to know whether this is anxiety or pain, probably both. And they positioned her, and then they say once anesthesia was found to be adequate, the dilators were removed. The anesthesia medications weren't given until 11:27.
The anesthesia staff then starts her meds at 11:27 and starts with Versed, so a benzodiazepine, and then propofol, which essentially makes her unconscious.
2 minutes later, they gave her more of the propofol. So she may not have been completely under yet. You give the drugs, you wait a minute, make sure the patient's asleep, then you start the procedure. So I think the earliest would be 11:28. It may have been 11:29 when the second dose of propofol was given. So then they prep the vagina, they apparently turn on the ultrasound.
So, it's going to take a few seconds to pull out the dilators, but According to HibaCleanse, their material is it should be a 2-minute prep, allow it to dry, and then do another 2-minute prep. I mean, that should be at least 2 minutes. So you're now at least 3 minutes in, and then the procedure, however long that takes in addition to that minimum of at least 3 minutes.
If they couldn't start until anesthesia was adequate, which had to have been like 11:28 at the earliest, and the procedure was over at 11:31, so that's only 3 minutes. There's no time to do much of anything else.
Yeah, I don't know how they would do a dismemberment type D&E in that period of time on a 20-week baby. I have no idea how they're going to do that.
Especially if she then suctioned the uterus to make sure that everything was out and possibly to get the placenta.
And then they inserted the cannula into the uterus and performed a curettage until a uterine cry was felt. In other words, there's kind of a gritty feel that you feel confident that everything's out.
About how long would that take to remove the placenta?
You know, it depends on how far along you are, because obviously as you get further along, the placenta's larger. There's more volume to it. Once you're well into the second trimester, it's usually a few minutes.
Say you curetted the lining for a minute, that takes you to 30, you'd only have 1 minute to do a dismemberment abortion, and averages 10 to 30 minutes. They only used a 12-section cannula, which is what you would use on a 12-week pregnancy. So that 12-section cannula could not be used to remove a 20-week fetus. There's no way that baby just went into the cannula. So something is very strange here, something's very wrong.
So to recap, after bringing Clementine's mother, who was experiencing labor cramps, into the operating room, Cherry Hill started anesthesia at 11:27 a.m. Then they waited 1 to 2 minutes until anesthesia was adequate to start doing anything to her body. That takes us to 11:28 or 11:29 a.m. when they took another 2 to 3 minutes to prepare the operative area on her body. That takes us to at least 11:30 a.m. And then Cherry Hill recorded the procedure was finished at 11:31 a.m. after doing a final section curettage that took at least another minute or two. So in total, the anesthesia and procedure times documented by Cherry Hill barely leave even 1 minute for them to take Clementine out of her mother's body.
So how did they get the baby out? And he has nothing there.
If I had to give you my suspicions, I would suspect that when they removed the dilators, perhaps there was a big uterine contraction and the baby was completely delivered. The thing that's so crazy about this op report, I guess, is that they talk about placing an Alice clamp on the anterior lobe of the cervix, and they use that to stabilize the cervix. It doesn't talk about inserting any other instruments other than the suction cannula. Nowhere do they talk about inserting any other instruments or removing the fetus or saying the fetus was already in the vagina. There's nothing there.
So, if I was doing the D&Es the way I did it, where you actually took the babies out in part, I would say I introduced this kind of forcep and that I grasped these parts and that it was introduced until all of the parts were out, that they were accounted for. So I would have all of that in my operative note because I want to remember what I did in the future, especially if she has complications. It's also a document for billing. It's also a legal document.
Why would you take the time to say you're putting an Alice clamp on the cervix and then leave out the most important part of the procedure, which is the delivery of the baby? So I suspect either the baby was expelled completely or at a minimum that the feet were visible and they could just pull on the feet without having to use a clamp, just pull on the feet and deliver the baby.
To me, the only way you're going to get that done is either the baby's already mostly exposed, if not exposed, or the feet are accessible, or you can get that baby flipped around quickly. The only way to get that out and have it done so quickly is to grab the baby's feet, pull, and hopefully come out intact.
I think they're purposefully being evasive because they don't want to fall under the Partial Birth Abortion Act or the Born Alive Act. In any other circumstance, they would document the baby came out in pieces, the baby was delivered intact, whether that baby was alive or not.
You should have a section that says findings, and I didn't see a section that said findings, but it should be there exactly. If the baby was already in the vaginal canal or partly delivered, that should have been in the note.
Now, you would think they would want to document those things to protect themselves, but they wouldn't be able to if the baby was born alive. And I think that's why you're not seeing them document any of those things. The fact that the tissue procurement company is noted here under remarks, then everything in the op report makes sense. That sort of ties everything together. Why their op report was not more forthcoming, why they would give the misoprostol to bring on contractions to overdilate the cervix and possibly cause a spontaneous birth. Because the ideal is to obtain tissue from a baby who has just been killed, so that there's a minimal amount of time from the time the baby dies to the time that they can get that tissue on ice and preserve it for their studies. They need fresh tissue. And knowing that, everything makes sense as you're reading this op report and you're looking at the way that she was handled and treated, the fact that they don't describe how the baby was delivered, the fact they didn't state whether the baby was alive at the beginning of the procedure or if the baby was alive at the end of the procedure. Was this baby delivered intact or in pieces? They've left out everything that could tell us what really happened, and they didn't want to fall afoul of either the Born Alive Act or the partial birth abortion ban, which they would if that baby was born alive. That is just horrendous. And here it is, right here. Here it is. There's no way they could have done a standard D&E in that amount of time. They moved things along, gave her that big dose of misoprostol so that she would pretty much just spontaneously deliver or enable them just to pull the baby out while the baby is still alive. And I think that may have been what happened here.
On the day of the procedure, as noted in the medical records, Clementine was at least 5 months and 1 day old, 20 weeks gestation. That's just 1 week away from paraviability, the age at which human infants are known to be developed enough to survive outside the womb with appropriate medical attention. However, there is a significant likelihood that Cherry Hill's gestational estimate was low because ultrasound dating becomes less accurate later in pregnancy.
Your best so-called dating ultrasound is going to be in the first trimester. So in the first trimester, it could be off by just several days. The further along you go, depending on her nutrition and all kinds of other factors, that baby could be falling off its growth curve, or it could be on a normal growth curve. So there's a lot more variance because there's so many factors as she gets further in the pregnancy.
If the gestational age of 9 weeks given when Clementine's mother was in the first trimester was more accurate, then Clementine was actually 21 weeks gestation at Cherry Hill, the earliest age of survival outside the womb for micropreemies. This means if Clementine was delivered alive at Cherry Hill and then handed off to Cercle for organ harvesting instead of being rushed to a NICU, it was a clear violation of her and her parents' civil rights under the Federal Born Alive Infants Protection Act.
You would certainly give that baby comfort care. You can't just harvest their organs or murder them at that point. Maybe they won't be able to survive, but you have to treat them with dignity and take care of them. And you can't just leave them on a cold metal tray to die. And that's what doctors have been doing, is they just neglect them so that they die.
Cherry Hill and Cercle treated Clementine not as a baby, but as a specimen. They dehumanized not only her, but also her mother. And that was all the more evident by the way they treated Clementine's mother once the abortion was completed.
I woke up in a room I was prior in. My clothes were there so I could change, and I almost fell over in the bathroom because I didn't even feel like a person. Then they walked me out to my escort and I was gone. No one ever really seemed to care about my well-being or my mental state. They just wanted me in and out of there.
Clementine's mother was already in a paralyzing state of mental crisis when she arrived at Cherry Hill. After the abortion, she was in a state of even more severe shock, trauma, and numbness. In the weeks that followed, she reached back out to Tommy, and still reeling from grief and desolation, they started to put the pieces back together.
Tommy and Clementine's mother began calling Cherry Hill on March 15, 2024, asking for their little girl's remains.
It was a hostage situation where we were trying to find our daughter and beg them, please help us. We need to find our daughter. Can you tell us where you put her? Can you tell us what you did with her?
At first, the workers told them that they didn't know where their remains were. A day later, that they couldn't tell them where their remains were. And then the facility blocked their numbers.
They didn't care about her mental state before the procedure, but when she was begging them for where her child's body was to give her a funeral, that's when they started saying, you might need psychiatric care. That's when they were caring about her mental state. Once you start asking questions and once you start figuring out what's happening at this evil, evil place.
It took nearly a month for Cherry Hill to respond with some of the medical records, and another month for them to send the consent forms.
If the information is there and the patient wants it, then you should be giving it to her.
When Clementine's parents closely examined the documents, they were horrified by the story that they told.
Now I know the truth. I never wanted Clementine to be experimented on or to be sold for money.
How many pieces is she in? Is she whole? Is her body on standby in a freezer? Did they dissect her on site? This was a human trafficking. They trafficked my daughter's remains. When they were done torturing her, they sold her body, purchased by the procurement agency, resold a second time to a research center or a lab who will continue to profit off of her on so many different levels. Cherry Hill Women's Center is a hub. It is not only just a murder mill, it's the auction block. They are selling dead children. And I don't think that people understand how serious that is. There are so many different experiments that they could be doing on Clementine. Terrible experiments. If her body was viable enough for her hair to be growing on the back of a rodent, she is still alive in a way. Her hair is still growing.
Clementine's parents are working with attorney Catherine Glenn Foster from First Rights Global to file complaints with multiple federal and state authorities as they continue the search for their daughter Clementine.
Parents should never have to become investigators to find out what happened to their child. And Clementine's parents have been searching for their baby for years. But the government has investigative tools that families just don't. So it can compel records, it can trace transfers, preserve evidence, and determine whether Clementine's remains can be located and returned to her family. Clementine's parents may have multiple avenues available. We have filed complaints asking state and federal agencies to investigate whether laws governing consent, fetal tissue practices, patient rights, born-alive infant protections, and more were in fact violated here.
Here are the facts that we know. We know Cherry Hill didn't kill Clementine with a feticidal injection before giving powerful labor-inducing drugs to her mother. Cherry Hill didn't document using any medical forceps instruments to crush or dismember Clementine or to pull her out of her mother's body during the abortion. Cherry Hill recorded anesthesia times and procedure steps in the OR that doctors say would barely leave even 1 minute for Clementine to be taken out of her mother.
But if Clementine was delivered alive inside that clinic, Cherry Hill did not document any record of assessing her vital signs or providing any medical help. Just the record of handing her off to the harvesting company, Cercle Allocation Services.
And we know that when Clementine's parents have asked Cherry Hill and Cercle for more facts about what happened to their daughter, both the abortion clinic and the harvesting company have refused to provide any further information.
This is not an isolated incident. Tens and thousands of women and men, mostly without knowing, have had their preemie-aged babies harvested from them at taxpayer-funded abortion clinics across the country.
This is just the first case where the baby's parents have come forward quickly with the basic medical records of what happened to them and asked for help to find their child.
You know, more and more, there are states where they're removing all the restrictions on abortions. And so suddenly, women who are having abortions are almost second-class citizens. You know, they're not getting the same level of care and oversight that you get for any other procedure.
The tragedy of Clementine and her family isn't the product of just one group of bad actors or a handful of exploitative clinics. Big abortion has an entire industrial complex motivated by profit backing it, a system extending to the media, to academia, to the government. that incentivizes its crimes and perpetuates its violence, killing babies and violating women every day. Clementine's case is not an outlier. It's a window into how the system operates. And that's why Clementine's parents have resolved to help all who have been impacted by the predatory behavior of the abortion harvesting industry.
I am so proud of Clementine's mother for being so brave. This is her first time speaking out. There are lots of other women that are victims to fetal research, and again, it's a conspiracy. Here are two women that had human rights that were absolutely violated, and this has happened every single day. And you should wonder, if you've had an abortion, is my child being experimented on? This is something that is not just my family's problem. There are so many other families that don't even know. So it's going to take the court system to make sure that these people cannot hurt any more women and cannot hurt any more children.
Since the procedure, how have your views on abortion changed?
My views have changed completely. I think we can all kind of just understand that whether you want to be pro-life or pro-choice, that this was wrong. And I'm not special. Like, this happens to women and innocent babies multiple times a day, all across the world. So I think we just need to open our eyes a little bit.
This was not bodily autonomy. This was not consent. And everyone should be concerned.
The sole desire of Clementine's parents is to honor her with a funeral and lay her to rest. But to do this, they must first stop any research experiments on her tissues, and then they will recover whatever they can of her remains. Ensuring dignified repose for Clementine's body is the only thing that will bring closure and peace to her family.
I think about her every single day. I still don't know what happened to her. There are other documents and receipts that are logged which would be able to tell us where they sent my baby. I need to make sure that these experiments are stopped, and if there is any way to get her remains to give her a funeral, I want to do everything I can to save her.
I really do have hope that we will be able to find even the smallest stem cell of her body, to lay her to rest, to give her dignity, to give her respect. Nothing else helps. The only thing that's going to help with healing or acceptance is when I know that the experiments are done. This is a real person. This is a beautiful little girl who suffered in the worst way, and her mother suffered with her. Clementine will not be a victim. Clementine will not be an experiment. Clementine will go back to being Clementine. Right now our family is broken and things are just as hard. We're still struggling, probably struggling even worse without our daughter than if we had our daughter.
Even now, I regret the abortion. I was wrong. I was going to be an amazing mother. I love her so much. I wish I had my baby.
I miss her, like, a lot. She is a piece of both of us.
How will you carry Clementine forward?
Making sure her story's told and it's impactful, you know, and it's important.
Every single person that speaks about Clementine, they are keeping her alive.
The most important part really is saving her, you know, it is. It's the whole reason why we're doing everything that we're doing. And saving her, you know, making sure that this never happens again.
Please help save my daughter. Please help stop these experiments. Please make it so that we can give Clementine a funeral.
Here's what you can do to help. First, ask the HHS Office of Civil Rights, the HHS Office of Inspector General, and the DOJ Civil Rights Division to escalate their investigation of Clementine's parents' case, to find out what happened to their preemie-age daughter Clementine, and to investigate civil rights compliance at all late-term abortion centers that kill viable age babies or are involved in fetal organ harvesting experiments.
Second, ask your congressional representatives to demand oversight of federal fetal trafficking investigations and funding at the DOJ and HHS.
Third, support Clementine's family's legal fund at the link below.
To aid Tommy Kearns in his mission directly, you can donate to or volunteer with the organization he founded to honor his daughter, Clementine's Voice.
Finally, if this story sounds similar to something that happened to you or a loved one, please speak up. What happens to vulnerable people and their infant children in the abortion industry is not fair. And together, we can try to make sure that it doesn't happen to anyone ever again.
What would you have to say to other women?
That it's okay to be scared, and it's okay to be uncertain, and it's okay to love your baby.
Justice for our Clementine. 20 weeks harvested alive. Cherry Hill tore her apart. Hidden truth broke mama's heart. Justice for our Clementine. Nothing about this will ever be right.